oncologist in Davidoff Cancer Center. I'm a specialist in treatment of sarcoma, meaning bone and soft tissue tumors, and I lead the sarcoma clinic in Davidoff. I am a board-certified medical and radiation oncologist from Israel, and I completed a long fellowship in sarcoma and thoracic oncology at the Princess Margaret Cancer Center in Canada, after which I came back to Israel to open the sarcoma clinic here. I treat bone and soft tissue tumors, mainly sarcomas, but also sometimes benign bone and soft tissue tumor as desmoid tumor or a giant cell tumor of the bone. Generally, sarcomas are a very large family of tumors originating from soft tissue and bone. These tumors are very rare. They're more common in younger adults. 10% of people under 40 years old, 10% of the tumors in people under 40 are sarcomas, while only 1% of the tumors in people above 40 years old are sarcomas. So these are quite rare tumors. And when we're talking about sarcomas, we mean 50 different types of sarcoma, of bone and soft tissue sarcomas. Some of them are so rare that some oncologists have never heard the name. In fact, sometimes I receive a pathological report from a pathology lab outside of our center with a diagnosis of subtype of sarcoma that doesn't even exist, meaning you have to be a specialist in sarcoma pathologist to have the right diagnosis. When you're treating such a rare tumor, you have to be both experienced and work with a team of people who are experienced in diagnosing, imaging, operating, and treating these type of tumors. In our team here in Davidoff, all the members of the team have undergone fellowship involving treatment in soft tissue sarcomas or generally in sarcomas somewhere abroad in the US or in Canada in order to acquire the appropriate experience in treating such tumors. Over the past decade or so, there's been great progress in treatment of sarcoma, both in the surgical techniques, radiation techniques, with more and more use of IMRT technique to treat preoperatively sarcomas. And within the scope of systemic treatment, there has also been great advances, including new chemotherapy agents as Yondelis for liposarcoma and leiomyosarcoma, eribulin, which was recently FDA approved and is available in Israel and in our center for liposarcomas, and biological agent as pazopanib, Votrient, which is also available here. I think the main and the most important advance in the treatment of sarcoma is that over the past decade, we realized that it's crucial to treat sarcoma in a team. One certain physician cannot treat sarcoma by himself. And here in Davidoff, we established a sarcoma tumor board and sarcoma team that basically treats all the patients conjoined. We have on our team a specialized sarcoma surgeon, Professor Gutman, a specialized sarcoma radiation oncologist, Professor Fenig, two radiologists that gives us, that helps us within the tumor board, and a sarcoma pathologist, Dr. Susanna Horn. basically, when we're looking at soft tissue sarcoma, biological therapies have not emerged and have not taken a very important role, with the exception of GIST, gastrointestinal stromal tumor, where the treatment is based on biological agent. And we have here in Israel 3 lines of biological targeted therapy for GIST. In other soft tissue sarcoma, we do give a biological agent, which is pazopanib, although this is not a targeted agent. But it is a very effective treatment taken in pills without the side effects associated with chemotherapy. In the last year or so, there has been extensive research looking into immunotherapy in sarcoma. The first result has been reported just a month ago in a very big conference. And it appears that these treatments are going to be the next new thing in sarcoma, but this is still in research. We do have a study here enrolling patients also with sarcoma for immunotherapy, but this treatment is not available outside a clinical trial. So as I said before, we know now more than before that treating sarcoma as a team is crucial. In fact, it was recently reported from the French sarcoma team, after reviewing 13,000 patients with sarcoma, that patients that are treated by a team, by a multidisciplinary team of people who are experienced in treating sarcoma, have better outcomes of surgery and have better survival. The cure rate is higher when you're treated by a team, an experienced team. So we make it a rule here to treat all sarcoma patients in a multidisciplinary team. Decisions are taken by a team. If surgery is needed, the whole team meets. We overlook on the imaging and the pathology. We have a pathologist on our team, and we make a joint decision whether to go straight to surgery, start with radiation and surgery, maybe chemotherapy, radiation and surgery, and each case is discussed. We also have a very experienced team, and since sarcomas are highly rare tumors, and when we're saying sarcoma, we're meaning 50 different types of tumors. Patients who are treated in an unexperienced center or by an unexperienced oncologist, the outcome can be worse.